Let's go take a walk and get you situated.
Okay. Right? I just want one more.
You can see there's not a lot of additional tissue inside of the ovary there. You can give a specimen at home as long as it's at a lab like this within about an hour of producing it.
Fertility specialists such as Dr. Shaheen Gadir of Southern California Reproductive Center in Beverly Hills.
I think this is a huge stride for us in the field of fertility.
Hello.
How are you?
Very good.
Good. I've heard a lot of great things about you.
There's a lot of women that really struggle to get pregnant in their late 30s and early 40s.
Right. I guess that's why I was like, am I too late?
I don't think so.
Okay, good.
We're sitting down talking with Dr. Wendy Chang about women freezing their eggs.
As we get older, pregnancy rates dramatically drop. So the woman's monthly chance of getting pregnant is probably about 30% in her 20s, down to 5% at 40.
Cytoplasmic transfer involves an unfertilized egg from a young donor, and we take some of the material from that egg, and then we inject that into eggs that are lacking a little bit in that energy, that vitality. It's almost like giving, say, like a big monster drink.
Hi, I'm Dr. Alexander. It's so nice to meet you.
Nice to meet you, Burl.
Hi, Ragini. Nice to meet you.
We're at a fertility clinic today to take a blood test that basically checks to see if I'm going to have any problems having a baby because of my age.
At 35 is when we talk about the risk of higher genetic disorders that can happen.
Dr. Mark Surrey, a fertility specialist who uses the embryoscope, says the device is especially helpful for older women.
And in patients in whom they have had failed cycles previously.
You know, it takes a little courage to come in today. A lot of women are thinking about it, but they're afraid to come in because of the injections and the hormones and the cost.
Right.
But it's a great thing to do.
You notice here there's these little bubbles that are all over the ovary. Those are showing us what's called an antral follicle count, that your ovary is actually very healthy.
Instead of just that one egg that she produces every month, we cause her to develop a whole bunch. Injection of the sperm into each individual egg on this machine here.
Dr. Wendy Chang is the scientific director at the Southern California Reproductive Center.
Possessing genetic information, or DNA, from 3 different sources, not just the father's sperm and the mother's egg, but also something called mitochondrial DNA coming from a healthy young egg donor. Why do we want to do it? Because healthy mitochondria are essential for survival.
Being 31 years old and doing this is much better than doing this at the age of 41.
We're not changing the egg. We're just evaluating it.
But I like to think that it pauses the clot.
It takes a lot of the guesswork out, so that our pregnancy rates are higher than they've ever been now.
There's a very good chance that 4 months from now, my dear, that you will be pregnant with a healthy pregnancy.
They're now a family of 4.
After all those years of trying, our dream came true.